Okay. Hi, Carolyn. This is my abdominal chest assessment. Sorry, it's like a weird angle. I didn't have like a tripod or anything. So I'm going to verbalize a whole lot so that you know everything that I'm doing. So I would come in, or I'd knock and come in. I would wash my hands and I'd say, "Hi, Sarah. I'm Gretchen. I'm your nurse today. I need to do an abdominal and chest assessment on you. Is that okay?"
That's fine.
All right. Can you state your name and date of birth for me, please?
Sarah Capone, 092396.
And I checked your wristband and cool. That's who you are. And so I would provide for privacy and make sure my stethoscope is clean and we could get started. So first thing I'm going to do is I'm going to just inspect your chest. You have a pink color, so that means good circulation. And I would just feel for your temperature and make sure that you're nice and warm and you have no cold spots or anything like that. And then I would just look at the shape of her chest from the side and see if she has any barrel chest. Can you lift your arms above your head for me? And she does not seem to have any barrel chest, pigeon chest, anything that would have a respiratory disorder along with it. And so next I'm going to listen to her lungs. I would normally do this posterior, anterior, and laterally. I'm just going to do the front just for time's sake. Take some deep breaths for me, please. All right, and so I'm going to put this back here. Can you count to 5 for me, please?
1, 2, 3, 4, 5.
All right, and can you say letter E really long?
E.
All right. So her voice is muffled, and then when she said E, it sounded like E, so that means there's no ego trophy, which is good. And then next I'm going to move on to her heart. First, can I have you lay down? So, I'm sorry if you can't see all this. So I'm assessing her chest for trills or heaving, and so I don't see any visually, and so I'm just gonna palpate, and I don't feel any heaving or anything like that. Next, I'm going to move on to palpating her pulses. So I would do this bilaterally on both sides, but I'm just gonna do it on this side. So I'd start with her temporal pulse up here. And I feel that one, and then can you just tip your head back a little? And I'm going to feel for her carotid. Good. And then her brachial. That one's hard. Can you just like, there we go. Thank you.
Mm-hmm.
Okay, and then her radial. And then skipping for femoral. So I'm not going to touch you. And then her popliteal, which I'm really bad at this one, so I don't know if I'll actually be able to find it, but I know it's back here somewhere. No, I can't find that one. And then her heel pulse down here. I'm good at that one. Maybe. There it is. All right. They're all +3, really good, strong pulses. So that's good, and I would do it on the other side. I'm not going to right now. And then I'm going to listen to her heart, and I'm going to listen at her aortic, pulmonic, herbs, point, something, and then, sorry, I'm going to look at my notes. Tricuspid, and then mitral valves. I'm going to do that, and it's down and then across in the way that it goes. I know you can't really see that, sorry. Alright, so the aortic. Alright, and I think that her S1 and her S2 are loudest at the aortic spot. I just think that though. And so next I'm going to move on to her abdomen. And so I'm just gonna lift your shirt a little bit, just right here so I can see. So I'm gonna inspect it. I don't see any striae, discoloration. The hair seems to be distributed evenly. I don't see any herniation signs, and I don't see any scars. Have you had any abdominal surgeries?
No.
Nothing like that?
No.
Okay. Have you had any tenderness lately, any pain?
No.
Okay. So all of that looks good. So next I'm going to auscultate and listen to all 4 quadrants starting in the lower right. I'm looking for 5 to 30 vowel sounds in a minute. I'm not going to count them just for the sake of time, but that's what I would look for. And she does have active vowel sounds, so that is good. And so next I'm going to palpate, starting in the lower right quadrant again. I'm going to palpate lightly and deeply. So lightly is 1 centimeter deep, and then deeply I'll go 5 centimeters because she is smaller. So I'm going to move clockwise around, but starting in the lower right, I'm lightly palpating for any muscles that seem to be out of place, or any skin differences, anything that's superficial that I'd be able to find. And I don't see anything that looks out of place. And now I'm going to palpate deeply, and now I'm looking for more organ displacement or tumor lumps, anything like that. That would be a little bit lower, and I do not feel anything there either. So I'm just going to double check that I did that. Okay. And then, so next I'm going to percuss. And so I do it in the same manner, where I just use my finger and I listen for any tympany or dullness. And this all sounds good to me. It's kind of hard to hear sometimes, but that sounds good. Let's see. Sorry. Inflection, auscultation, palpation, and percussion. And so then the last thing that I'm going to do, I'm going to have you sit back up, and if you can turn your back towards the camera so I can, I'm going to assess her CVA tenderness. And you haven't had any back pain recently, have you?
No.
All right, and so I'm just using my hand and then my fist, and I'm just pretty lightly, but also strong, palpating. Is there any pain in here, Sarah?
No.
All right, that's good. Going along either side of her spine. And then I'm just gonna double check I didn't miss anything. I think I got it all. So thanks, Carolyn. See ya next time.